I want to provide some updates regarding our data that pertains to COVID-19. The first slide I'm going to show you is our new confirmed cases. And again, you can see this hockey stick appearance that has formed on the right side of your screen. This represents a substantial increase in our number of cases that have been reported over the past week or so. When we look at our data from last week compared to the previous week, our case numbers have increased by 90%. So this really is a substantial and exponential increase in the number of cases that we're beginning to see, which is leading to our concern that we shared earlier this week. When we look at that in terms of doubling time, how long it takes that we expect for the cases to double, we can see that we were sitting at about 44 days, which was really good. In fact, you can see from this trend, the yellow line, which is the 7-day moving average of that doubling time, was continuing to increase since the beginning of this pandemic. And then suddenly we see that drop off. So in the past week, we've gone from 44 days to 25 days. So dramatic change, also indicating a substantial change in our conditions here locally. And finally, on this slide, you can see that we also have had a substantial increase in those number of new admissions on a single day. That's the yellow line that you see here. You can see that we were oscillating between about 8 and 10 new admissions a day, and now our 7-day moving average is sustained above 20, which necessitated our movement, along with the other indicators, to that stage 4, which is the more cautious stage, so that we can try to bend the curve again, try to flatten the curve, and try to get a handle on this issue. I do want to point out some new data that we also have, and that's related to hospitalizations and the length of stay. The bottom of the box represents the 25th centile, and that means that 25% of individuals hospitalized are hospitalized for 2 days or less. The middle line in that box is the 50th centile. So 50% of individuals hospitalized are hospitalized for 4 days or less. And the top of that box represents the 75th centile, which means that 75% of individuals are hospitalized for 9 days or less. So these are significantly lower numbers compared to other data related to length of hospitalizations. You can see these dots that go all the way up past 70 days indicates other cases. So we do have some individuals who are hospitalized for weeks and sometimes months, but the vast majority of individuals are less than 9 days. This slide is an update of our demographics associated with hospitalizations. The green line at the top represents our Latinx community. And again, you can see that that community is overrepresented in terms of hospitalizations, with 65% of individuals hospitalized last week being from our Latinx community. You can see that our yellow line is our other category, so we don't know too much about who makes up that group, but the two lines above it are our blue line, which is our white non-Hispanic, decreased and is underrepresented in terms of our population. And the gray line is our African-American population, 9.2%, again, also indicating overrepresentation of our African-American community members in terms of hospitalizations. When we look at our testing numbers, and we've had a lot of questions about our testing numbers, you can see the total number of tests on the left column, which indicates that we've more than doubled our testing in the last week. And we're proud of that. Our teams have been doing a great job at getting folks through the testing. This data is just for our drive-through testing sites, but you can see an overall percent positive of 5.8%, which is not a bad number. But when you look at the details of that number, it shows us a different story. It shows us that 23.5% of our Latinx community is positive that have gone through the drive-through testing. It shows you that our African-American community is 7% positive, again, significantly higher than our overall numbers. And our Asian American community is also significantly higher than our white non-Hispanic community. So there's still substantial variation in terms of race and ethnicity when it comes to both being diagnosed right now with COVID-19 and hospitalizations. Look, I agree with the governor's comments that hospital capacity is not a concern today. It's not a concern for us today. We have plenty of space. There's plenty of PPE in the hospitals right now. The workforce is healthy and present. That's not our concern. Our concern is 3 or 4 or 5 weeks from now, if this skyrocketing trend continues. At that stage, our hospital capacity could be overwhelmed. Our ICUs could be overwhelmed. Our ventilator capacity could be overwhelmed. We could be facing a shortage of personnel because there's so many patients, or because they themselves are being exposed. So we do not want to sustain a trajectory that we have right now, because we can't. We've seen this happen over and over and over again across the world, that when we wait too long to sound the alarm keeps ringing for weeks and weeks, far surpassing our ability to care for people. And we're talking about the potential, if we wait too long, of exceeding hospital capacity by thousands of individuals in a single day, as far as needing hospital beds that we cannot provide. But it's a nuanced message. The message is we've got to change our behavior today to affect that in the future. But we also must take care of those health conditions that we have been neglecting. We've got to get immunized if we've been putting that off. We've got to get our physical examinations done. We have to go get our medication refills. We need to not delay those elective procedures or those diagnostic procedures that we may have been putting off because of our concerns for COVID-19. The hospitals are safe and healthy today. There are plenty of nurses and doctors and equipment and room for people. But that should not dispel the cautionary note that we must share, that we cannot maintain this trajectory. And we as individuals, we as a community, have to come together to alter the course of this curve. We've got to flatten the curve. We've got to downgrade the storm, because we're in this for the long haul. We've got another year left of dealing with this. So we also need to find that right spot, that sweet spot where we can deal with the infection, but also have a life which is more normal than it has been over the past couple of months.